So I think we'll make a start actually. So I'd like to welcome Amy Murney to give this second case study. Amy is Principal Teacher for Pupil Support at Dunblane High School and currently seconded to Stirling Council as Coordinator for School Counselling. And I'm delighted that Amy is going to tell us about the fantastic work particularly the pupils have been doing at Dunblane High School around health and wellbeing data. So Amy, you'll talk for about 10 minutes and then some questions at the end. That's great.
Yeah. Thanks Judith, and thank you to Shine for having me along today, and thanks for everyone for joining us. So as Judith was saying, my case study is about a little bit of work that we did last year at Dunblane High School, looking to use our pupils as leaders to drive forward a whole school intervention round about mental health. So I'm going to give you just a really brief snapshot of that today, and as Judith said, there'll be a wee bit of time for questions at the end. So just to give you a little bit of context, so Dunblane High School is a mainstream secondary school in Stirling Council. We've got just under 1,000 pupils. Much the same as I'm sure all other schools in the last few years, we've had a real focus on mental health and wellbeing, and on kind of embedding whole school initiatives and developing support further in our school. And that's something that I've been quite involved in, as that is part of my whole school remit as PT Pupil Support. It's on sort of coordinating our mental health action plan. What I'm really keen on is involving pupils in that and giving them a real voice and driving that forward. And in the last few years, we have had a group of mental health champions in the school, and that's worked really, really well in the initial stages, just to have that kind of group of volunteers across the school that are really passionate about this, that want to drive things forward. And that certainly led to some really great developments and great progress in the initial stages. What I was finding was that the bigger it got and the more initiatives were taking place, it was becoming a wee bit less sustainable in terms of sort of meeting them at lunch times, and I was just kind of struggling with the time aspect of that really. So we did things a wee bit differently last year. We had it as an A6 elective that pupils could be mental health champions, and in addition to that, they also were working towards the National 5 Mental Health and Wellbeing Award, and that worked really, really nicely, having that kind of timetable time with them every week, a couple of periods where some of that time we could devote to really exploring mental health and learning about it, and having some really great conversations just to kind of bring up their knowledge on lots of different issues. And then we also used that time as well to talk about whole school developments and, you know, where our gaps were and what we wanted to drive forward. So it was just really good having that kind of ring-fenced time to be able to do that. So there is some of my very lovely mental health champions from last year. And as I said, we used that time between working towards the SQA award in mental health, which was brilliant last year. I would really recommend that. And also they were a sort of pupil leadership group, a school improvement group around about mental health. So where we used our data, so obviously we had Shine School, we had our Shine report, and as a member of staff, I found that really, really valuable in terms of a really comprehensive report looking at our school. At that point, it was obviously quite a small sample of pupils, but just being able to look at, you know, how our school compared to other schools within our region, and maybe where the gaps were in terms of what we were doing, what we could do a wee bit better. So for me, that was really easy to digest, but I was aware that sharing that with pupils maybe would be a bit too much information to give them. So what I chose to do was to kind of pull out, I suppose, some headlines from that, and I just put that into a sort of A4 sheet, and we used that as a really, really interesting discussion activity where we were able to have conversations about whether they were surprised with any of that information, why they think that maybe we look to be a bit different from other schools, or, you know, just kind of what they made of that information. It was a really worthwhile activity to do, so that's kind of what that looked like. And then from that, we identified some of the areas that we were most keen to move forward in addressing last year, so what their kind of priorities as a leadership group were going to be. Interestingly, the conversation focused around the kind of the gender-based kind of headlines that came from that report. So what we found was that the boys were less likely than the girls to use their peers as support. They were more reliant on staff support within the school, and much less keen on going to their peers to access support for their mental health. And also that the boys in our school were a wee bit higher than the average amongst our RIC in terms of stress towards school. So there was a couple of things that were very interesting. It tied in very, very nicely with the unit on influences on mental health that's in that course. So we were kind of exploring those themes anyway, and none of this was hugely surprising. Obviously there's lots of discussion amongst, you know, engaging men into kind of mental health support and opening up those conversations, but that's something that we really probably spent most of our time exploring, and that was something that the group were really passionate about moving forward with. So that then led to a bit of planning. We've done sort of different styles of whole school interventions around about mental health and whole school support previously, so we were keen to put something in place that would maybe start to address some of the issues that we discussed, but maybe do it in a slightly different way from what we've done before. So we had some conversations around, you know, how do we open up conversations about men's mental health? How do we encourage boys to speak to their friends and to offer support to friends about mental health? And how do we engage pupils that we've not necessarily maybe been able to engage in the previous interventions that we've put in place? So what happened as a result of that is that we had our first positive mentality day at Dunblane High School. And that was really led by our pupils, but it became a kind of bigger project between the mental health champions and myself, but then also between our arts, health and wellbeing faculty, specifically including the PE department. Within the PE department, we've got our sports ambassadors that are pupils. So it really became quite a big sort of project amongst different areas of the school, which was great, which was really good. And that's something in the past that we've wanted to push forward, that it wasn't just our mental health champions that were driving these kind of things. We would engage in other areas of the school as well. So we were keen to really start conversations around about men and boys' mental health. So we put up posters and we shared sort of statistics with staff and with pupils, and really encouraged those conversations to begin to open up around about why it's so important that we start to reduce the stigma amongst boys talking about mental health. We had a focus on really highlighting positive coping strategies, and what we chose to do was to look at sort of getting outdoors and being active as really key coping strategies that are positive in terms of managing and protecting positive mental health. So we had a day in November last year, this positive mentality day, and the PE department were great in putting lots of different activities in place and relating everything to looking at mental health and coping strategies. But it was a really fun, active day overall. So our boys spent, all the boys in the school spent different parts of their day off timetable doing sort of really interesting, engaging activities involving sport and outdoors. But there was also an element of choice in that as well. So we had our art department also put activities in place as well, talked about creativity and the importance of that in terms of a coping strategy. So some of our pupils created a mural, and that's now displayed in our atrium outside Murray Hall in the school. And the theme of that was all about sort of kindness and inclusion and speaking about how we're doing and looking after one another. And then another feature of the day as well was that we worked with a great local charity called the Chris Mitchell Foundation, and they're a local mental health charity, and it fits so nicely in with what we were doing at that point, because they really drive forward the importance of raising awareness about mental health and putting support in place for mental health, specifically around about football. And we had all our boys listening to a presentation from the charity on the day, which most of you will know, as soon as it's someone that isn't a teacher that's given those messages, sometimes you know, it's a wee bit more successful getting that message across. And we also wanted to make a feature of our day about working with that charity and raising funds for the charity as well. So it was a non-uniform day overall, and we donated funds towards the Chris Mitchell Foundation to support the great work that they do. So that is kind of what our day looked like. To give you a bit of context, earlier on in the year we had our Active Girls Day, in case anyone's feeling really sorry for the girls and all of this. So it sort of works to kind of complement that event that had already taken place in the school, which is about getting involving girls in sport. So this kind of contrasted quite nicely with that, but also had a real focus on mental health within the school. So yeah, so that was the idea, was that this was going to be a day that was in our school calendar. Obviously things at the moment make that a wee bit tricky, but that would be our kind of long-term plan, is that that this is an annual event that we look to improve upon every year, and we get some feedback into how we could do that. So yeah, so that's a wee bit about our day. In terms of if sort of keeping an eye on things, there's plenty of tweets and things about that event. Yeah, no problem. You are very welcome to sort of follow up. We've got a mental health and wellbeing Twitter, our PE Twitter and our art Twitter. All of those were involved on the day. And then obviously we've got a wee bit of time just now for questions, but if there's any other questions that you want to ask, Dawn's very kindly said that she'll forward anything on to me if I can help with anything that we maybe don't get around to talking about today. But otherwise, I think that's me, and it's just any questions.
Oh, thanks, Amy. That's brilliant. Absolutely great to hear those brilliant examples from Dunblane. So yeah, we have one question in already. So how did you deal with LBGT plus if you had boys girls day?
It wasn't really an issue that came up, but I suppose it would just be whatever gender a young person identifies with, whatever day they felt more comfortable being part of, then of course they would be very welcome to be part of that day. So to my knowledge, it wasn't really something that we had any bother with, but in my opinion, it would just be the case of going with whatever the young person feels more comfortable with.
Of course, yeah. No, that's great. Any other questions? We've got a few more minutes. We've still got time for some more questions. Here we've got one from Carolyn. Who provided the training for the ambassadors and what protections were in place for them?
So our ambassadors don't necessarily have a support role within the school. It's more about, I suppose, leadership of initiatives and things within the school. We do have some of our ambassadors that are mental health first aid trained, and it's not, I know some schools have maybe kind of used that as a support strategy maybe more than we have. That's been quite a recent thing, and it's not something that we've got our staff that are mental health first aiders, and we've got kind of routes to speak to them and support around about them. We've not really gone down the route of putting sort of peer support in place around about mental health, and that obviously is something that comes up a lot if you were to do that. What support is in place, what pathways are in place around about that. But in our school, our mental health champions, their role is more about sort of leadership of whole school events rather than providing support to their peers.
Okay, that's very helpful. Do we have any other questions then? Don't think there's any in the chat. So that's your S6 year. What about then, obviously you're having them as ambassadors, feeding on then you'll bring in younger groups. Have you any plans for that or anything like?
Yeah, so something we wanted to do last year then was to have our S6 mental health champions sort of leading the younger groups. It was something that we thought we would maybe get more uptake than we actually did. So it's not something we really got set up at the moment, because we did assemblies on it. We looked for to set up kind of younger groups and things, and there wasn't a huge amount of uptake in that. So that's something that I think it would be good to come back to, or at the very least maybe open up sort of focus groups with our younger pupils about why there's not necessarily much of an appetite for that at the moment, whether they feel that there's just that they don't have much to add to what's already happening, or whether they feel that they don't want to come forward to do that. I think that's something we need to come back to and explore, because that had been our plan for maybe a more sustainable way to have mental health champions. We'd have this timetabled senior group, and then part of their leadership role would be to sort of chair younger groups, and I would have a kind of overview in that, but it's not something we've got in place at the moment. And I think we do need to probably come back to that and explore why that is.
Yeah, okay, that's great. Well, there's no more questions in the box at the moment. So yeah, Amy, thanks very much for sharing all your experiences with us this morning. We're moving on to lunch now. I think everyone will be ready for that. We've had a very packed morning session. So I think we're back. I think the programme says back at about 10 to 1, but the presentation started 1. I suppose it's to be ready to start bang on 1 o'clock. So thanks very much, Amy, and thanks to everyone else back at home. Okay, thanks.
Thanks, bye.